The situation is considerably better than what it was in June and July when we had this massive inflow of refugees. The infrastructure wasn't there when the refugees arrived. So now we're in a much better spot. The international community has responded very positively. The Ethiopian government has been a strong partner in providing access to the camps for the international community. It's still a very tough, harsh environment. We're talking about the desert, the Ethiopian desert that abuts the Somali region. So it's not what we would call international standards of living, but much better off than earlier in the year. Our presence in the camp has been since 2009, but our priority has been providing services to children. So protecting children is number one in terms of identifying unaccompanied minors and ensuring that they are taken care of if they don't have any family or relatives to be with, identifying them and getting them into some sort of a foster care situation. And amongst the Somali refugees, that is a relatively smooth process because of the clan structure. So protecting children is number one. Two is providing activities in terms of early childhood education and school. And you get thousands of children together in a refugee camp and they don't have anything to do. They have more opportunity to focus on what they've been traumatized by, what they've seen, what they've gone through, lost relatives, etc. So early childhood education and education, primary education, is one way of ensuring that they're occupied, they're busy, and stimulating and motivating them for the future.
This is going to be the first time the students are going to use it. And these students, they have never been to school before. And today they will sit on the school desk for the first time in their life.
And then the third area is nutrition. So ensuring that children are fed. And Save the Children has been there since day one to ensure that when they cross the border from Somalia, there's a hot meal for them, and providing nutrition services for children as quickly as possible when they come into Ethiopia.
So what we do here is we provide supplementary food for the under 5 children, the pregnant and lactating women. And this supplementary food is in the form of porridge, which is CSB, oil and sugar, and then we enrich it with milk.
We've been very concerned, the international community has been very concerned that there are still very high rates of childhood malnutrition, and we're talking crisis levels. 33% of GAM, global acute malnutrition, which is beyond what any standard would be for emergency or crisis. The international community is probably going to hear less about the crisis in Somalia because there have been some rains. But that still doesn't change the nutrition crisis that we're facing in the Somali region. People still don't have access to food, they're still fleeing the fighting, and the need for international support is still as sharp as it has been in the past 6 months.